Thank you so much, Christoph, for being with us.
As
As you are working on the diplomatic global health, and I want to ask a question, how do you see a diplomatic effort to solve the health crisis that the countries are facing, especially after the COVID? We came to the point that not every country have a strong health system.
Right.
Then how it's important for the diplomacy to work on the health issue.
Yeah. So originally I'm an infectious disease physician who treated patients and who was working in a health system, particularly also in Africa. So I cared about the health of the people, but I also realized that to reach many people, you need national programs, you need strong health systems. So I turned to health diplomacy, because in the end you need politicians, you need funders to support these programs. So 20 years ago I turned more to global health diplomacy, working with many governments around the world, with international organizations like the World Health Organization, like the Global Fund to fight AIDS, tuberculosis, malaria, because we need these instruments if we want to reach millions of people around the world who are suffering from these diseases. And this week we have 3 high-level meetings on tuberculosis, which is still a major disease affecting millions of people, and we need to make sure that all people can, be diagnosed, can receive the right treatment to save their lives. We had a session on pandemic preparedness because we want the world to be better prepared for future pandemics. COVID has just been behind us. Millions of people have died, but the next pandemic will come in a few years. And how will we be better prepared to have vaccines for everybody very quickly in the pandemic? That's what we discussed here. And today we discussed also universal health coverage for all people around the world.
Has the politicians got any lessons from COVID when they are preparing for the future pandemic, if they happen in the future?
I would say yes and no, because yes, they have learned some lessons. On the other hand, we also realize politicians forget very, very quickly. We call that the cycle of panic and neglect. So when a pandemic happens, everybody's in panic. We need to do something. People are dying. The economies were suffering. We lost trillions of dollars in this pandemic. So everybody is, engaged. The pandemic is over. The crisis is over. And we then tend to move into the phase of neglect, because then other issues, are more important. Money is lacking. We have now a pandemic fund, that needs to be funded. But politicians are not providing, the resources required, to fight these pandemics. We have the Global Fund, we have Gavi, we have other instruments that are still very, very important. But politicians move to the next topic. And that's why we are here in New York, because then you can get the attention of politicians to say, hey, this is very important. We need to focus on that for the benefit of millions of people around the world.
Besides politicians, what about the World Health Organization? How did they handle it? I mean, it was a little bit obvious. There was people think World Health Organization didn't take an action
right
before it needed. And how they are doing now? As you said maybe in 2 years we will face a new pandemic.
Right.
Do you think World Health Organization is preparing themselves for this?
They're definitely preparing for this. And, we have to be realistic. The World Health Organization was notified of this new virus in January, 2020. And it within 6 weeks, they kind of realized, they called for an emergency. Tests were developed within 6 weeks, and we had a vaccine in record time. So, we have to give credit as well for what worked well. We have CEPI, which is a coalition for epidemic preparedness. They helped to kind of develop this vaccine very, very fast. Now, there was an issue with the distribution of the vaccine. Rich countries were reserving the vaccines first for themselves. They were not sharing the vaccines as it should have been. That's what we have to work on now, that next time we will have a vaccine much faster, and we will be able to distribute it to all people who need that, not just to the richest countries. So the World Health Organization, CEPI, Global Fund, others are really working on that. So we need to make sure that the world will be better prepared next time.
Since we start with the COVID-19, I just have a follow-up question.
Yes.
These days, especially last a few weeks, we hear more about the COVID-19 cases with the new variants.
Yeah.
What should we know? To be honest, we don't know a lot, but last a few weeks we hear more than we heard like a few months ago.
Right.
What's going on now?
Right. So this virus, which is a coronavirus, is there and will be there, and there will be new variants all the time. And the World Health Organization is monitoring that. They will assess how dangerous is a new variant, because we are confronted with viruses all the time, but we are not dying from viruses all the time. So this variant, is being monitored. We have to take that seriously, but it is not yet, very dangerous for many people. But there might be another variant, 6 months from now, that could be just as dangerous as in the early days, or a different type of virus. So we need to be prepared for that so that we can react quickly, that we can develop the right kind of responses, tests, treatment, vaccines. That's the challenge, and that's why it was great that the world leaders were coming together this week to discuss that, to remind us ourselves that it's not yet solved, right? We have to be very, very vigilant. So
I think during this General Assembly, the world leaders committed to double their efforts to facing the global health issues and putting more efforts to the global health coverage.
Right.
How are you optimistic about their commitment? Are they going to keep their commitment by 2030 to have a big coverage for the health issue that many countries are facing every year?
Yeah. So, yes, we have made a lot of progress towards this universal health coverage, that people have access to quality health services. But it is also true that in many countries around the world, particularly countries that are suffering from conflict and war, so-called fragile states and very poor countries, they don't have the health systems yet for the regular health services, and they are not prepared for any new pandemic, right? They are suffering the most. And let's not forget, what we also have is the impact of climate change on health, right? Increasingly there are diseases spreading because, the warming, climate change, that needs to be addressed as well. We need to have health systems that are resilient enough for the ongoing climate change. So all of that are big tasks, big jobs. It's great that the politicians committed here to kind of redouble their efforts. I wouldn't say it's sufficient yet. It needs to be followed up. But that's what these declarations are about, that governments can be held accountable, right? They sign up to something, a kind of, treaty, a commitment, and then they have to be accountable, that they really allocate the resources, the kind of capacity, that they strengthen the health systems. But we also need the international community to support those countries that still require international support.
Just today I talked to some minister of health from some other countries, especially from Africa, and they said that we've been neglected.
Yeah.
I know your organization is based in Geneva, and the World Health Organization is based in Geneva too.
Right.
How are you categorizing the countries based on their developing countries, undeveloped countries, and the issues that they are facing in their country? How the international body like UN and also the organizations like your organization are working with those countries that have more fragile systems?
Right. So the World Health Organization and other organizations are working very closely with those countries to strengthen their systems. Also, sometimes they need to subsidize drugs that otherwise would not be available. Take tuberculosis that we discussed here this week, which is still the kind of infectious disease killing most people in the world. We sometimes forget about the ongoing pandemics like tuberculosis. We have treatment. The people can be cured, but only if they get the right drugs at the right time. And some countries cannot afford to kind of, buy those drugs, and then they are supported by World Health Organization, Global Fund, international organizations. That's how it should work, right? Not all countries can have all the services available for their people. So we need this international solidarity as well, and that's what is also happening here at the UN, to kind of, create this kind of solidarity so that indeed universal health coverage, as we call it, health services for all, will become a reality and not just a dream.
And it's part of SDG too.
It is absolutely part of SDG that all countries have agreed to by the year 2030. We are to arrive at that point, that all people have access to quality health services. We are still a way away. And honestly, COVID, was backsliding a bit, right? Because it took away resources and so on. Some progress that had been made, was going backwards. Now we have to accelerate again. But also maybe to mention one element that we are also discussing here, how to use new technology. Innovation can also help. I'm working a lot on digital tools, artificial intelligence for health. This is a promise in a sense. We can accelerate this access to healthcare because we have tools now that you can also use at the community level that will enable primary healthcare, as we call that, at the community level, with new tools available through cell phones and so on, because we need that innovation as well, to reach those goals by 2030.
I think this is what they promised during the G20 summit.
Absolutely, and I was there at the G20 summit in India. We launched a new global initiative on digital health, hosted by the World Health Organization. I was speaking at that event to launch the new global initiative. That is promising. But again, we need to make sure that all people benefit from that, not only those who can afford the most, modern, technological tools. But these days, we can really put that into the hands of, every community health worker in any country around the world.
As you said, tuberculosis is still a danger for our community.
Yeah.
Besides tuberculosis, COVID-19, we are dealing with COVID-19 these days. How was it like 20 years ago, and how is it today, and what else can we add to those diseases these days?
Right.
Is there other diseases can cause danger for us?
Sure. So we have these diseases that are still around. They were before COVID, like tuberculosis, malaria is still a big problem in many countries. HIV/AIDS is still a big problem, hepatitis, for example. But we also have the non-communicable diseases. People are suffering from diabetes, from heart diseases, from cancer, and so on. And for all these diseases, we have, better treatment, better diagnosis. And by the way, we can use the digital tools often also for those diseases. We can more easily diagnose those diseases using those modern tools. But yeah, there are still, many diseases, but we're getting better and better in kind of having better tools for diagnosis, for treatment, and so on. But we need to make sure that all people benefit from that.
Yes, but what about the climate change? Do you think climate change is the biggest factor on those diseases, or do you think there's other factors?
Unfortunately, I do believe that climate change is probably the biggest challenge for health, for the next decades, right? We have really made progress. If you look at life expectancy has been going up in many countries around the world, also in the poorest countries. Child mortality has been going down. Less children die from preventable diseases. But climate change could reverse all that, because, of the effects of extreme weather events, rising sea levels, and rising temperatures, for example, so that mosquitoes, can spread diseases at higher altitudes than they could before. So unless we take that very seriously and prepare the health systems for this climate change, a lot of the progress we have seen could be reversed. And so we have to kind of address that.
Thank you so much, Christoph, for being with us. I know this topic is a very important topic, and we wish to have more time to discuss this,
Right.
and we wish to have you on Rudaw in the future and to discuss this in length. Thank you so much for being with us.
My pleasure to be with you.